Welcome to Change Class number 3, Managing Weight, Adding Physical Activity, and Helping Sleep Apnea. Objectives. Understand the causes of weight gain and strategies to help manage this. Review exercise guidelines. Identify sleep apnea characteristics and associated risk factors. What contributes to being overweight? Glands, hypothyroidism. This is a medical condition that, if not properly treated, may cause excess weight. Metabolism. Your metabolism versus your friend's metabolism may be different, and you may be burning different calories at rest. Genetics. Similarly, you and your friend may be of different backgrounds, and some of you may just burn calories a little bit faster or easier than others. Sex. Men versus women. Men tend to have more muscle mass, which burns more calories at rest, and tend to have a higher metabolism. Family upbringing. Social and cultural effects. Certain meals may be of different cultures, and those meals may contain a lot more calories and fat than of other cultures. Psychological factors. Stress, loneliness, anger. These are feelings that may contribute to a person reaching for that sweet treat more than not. Your energy account. A calorie is how energy is measured. Think of your account deposits are the calories consumed, whether you eat them or you drink them. A withdrawal in the account are metabolic processes such as breathing, blood circulation, growth, repair, even rest burns calories, but also physical activity. Managing your energy account. Excess deposits into the account leads to weight gain. Excess withdrawals, aka calorie deficit, leads to weight loss. A balanced account leads to weight maintenance. It is possible to eat any food you like and lose weight as long as the total calories consumed are less than the total calories burned. But calories count. For example, think of the gasoline that you put into your car, unleaded versus premium. The type of fuel or food you choose affects your health. A high-fat diet may increase the risk of heart disease. Refined carbohydrates or low-fiber diet may increase the risk of diabetes and heart disease. Not consuming any fruits or vegetables can lead to vitamin and mineral deficiencies. And also, lack of disease-preventing chemicals, things like antioxidants. Energy density. Foods that are high in energy density means that there are more calories in a smaller volume of food. Some good examples are simple sugars, alcohol, fast food, soda, candy, and processed foods. Foods that are lower in energy density, which means less calories and a larger volume, are fruit, vegetables, and lean proteins. If you know that you need more food to feel full, you should choose foods low in energy density. Foods such as fruit and vegetables tend to have a high water content, and water is calorie free. Lean proteins lack fat. Fat is often more calories and actually has more calories than proteins and carbohydrates. Here's a good visual example. So 1 cup of raw vegetables, 25 calories. If we do a fruit, fresh melon, it might be 60 calories. Fat-free milk, 90 calories. Cooked pasta, 160 calories. And regular salad dressing, a cup, 720 calories. So you can see how you can take an energy dense food such as salad dressing, and if you put it on a food that's not that energy dense, such as, let's say, a cup of lettuce, you can very easily turn something that's not calorie dense into something that is calorie dense simply by the dressing. Body composition analysis. At your appointment, they may do something called a Tanita scale, which is a body composition analyzer. If you see on the side here, it'll calculate things like your weight, the amount of fat mass that you have, muscle mass, bone mass, visceral fat rating. This looks at the fat that surrounds organs. And this is the type of fat that can lead to problems long term, things like fatty liver. Adding physical activity, where do you start? Well, you start where you are. You have to give up the all or nothing mentality. We all have busy lives, and if some days you just can't exercise, then you can't exercise. Or if some days you only get 10 minutes in, then you only get 10 minutes in. But saying, well, 10 minutes is barely nothing, so I might as well just not do it, is something we should try to avoid. 10 minutes is better than nothing. Set a realistic and achievable goal. If you know you absolutely hate working out or exercising in the morning and you would much rather do it at night after work, then I would advise trying to find somewhere in your schedule to do it after work and not trying to have yourself wake up at 4 o'clock in the morning because you may hit that snooze button and end up not going. All these small changes do add up. So think about taking the stairs, parking far in the parking lot, and walking to your job or when you're out shopping. Don't forget to stretch, especially before a more formal activity or even some type of active warm up to hopefully prevent injury. But also consider your limitations, right? We don't want to go from no activity and then sign up for a marathon, right? That's quite a jump in physical activity, or no activity and then signing up for a competitive pickleball league or something like that. Because that's where injuries most likely will occur. How much activity is needed? Frequency is going to be at least 3 to 4 times a week. Your long-term goal is going to be 45 to 60 minutes per session, but you may break this down into 10-minute parts. So if you need to do, 10, 20 minutes in the morning, maybe go for a quick walk during your lunch, another 10, 20 minutes, and then something after work. All great things. Daily steps. So the average person takes about 3,000 to 4,000 steps. 10,000 steps is recommended for health and weight loss. So find out your current steps and then aim to increase your steps by 1,000 every 2 weeks to get a goal of 10,000 a day. You may notice it might be difficult to do that during your workday, and you may have to add more of a formal walk into your day, whether during your lunch break, before or after your workday, or even if you have a break during the day, go take the stairs, something just to get those extra steps in. Another very important topic is sleep. Adults need 7 or more hours per night of sleep. Generally, when we have decreased sleep, we may have increased weight. So think of lack of sleep. You're exhausted and then you don't want to exercise. So now we're not getting our exercise portion in. And poor decisions in terms of, well, I'm exhausted and I'm tired and I'm just going to grab this donut. And then today, I didn't go to the gym. So I'm just going to get fast food today. And we're just going to make the whole day not count. So you may be more inclined to make these poor decisions for your health when you have a lack of sleep. Certain sleep habits can help improve sleep as well. Things like avoiding your phone or blue light before bed or getting early morning exposure to sunlight are important to help your circadian rhythm and sleep. Sleep apnea. This is a potentially serious sleep disorder in which breathing repetitively stops and starts. You may have sleep apnea if you snore loudly and you feel tired after a full night's sleep. Obstructive sleep apnea is the more common form, and then this occurs when the throat muscles relax. Causes of obstructive sleep apnea: excess weight, an, the neck circumference, a narrowed airway, being male or being older, family history, race, use of alcohol, sedatives, or tranquilizers, smoking, and nasal congestion. What are the risks of untreated sleep apnea? Excessive daytime sleepiness, accidents. Think about being extremely tired and having to go drive. Brain fog. If you're not getting that restorative sleep, it may be hard for your brain to function as well. High blood pressure, heart arrhythmias, heart disease, stroke, even death. Sleep apnea and bariatric surgery protocol. It's recommended to get evaluation and treatment of sleep apnea, continue treatment for a year, and follow-up testing. This concludes the end of Change class number 3. Please let us know if you have any questions and answers, and be sure to do your quiz.